So today we are going to be skinning a medium-sized, and actually I don't know if this is a female or a male cat, but I want to talk to you about the instruments that you'll utilize for each dissection. So today we are going to use a scalpel. Most of the time I'm going to ask that you not use a scalpel because it's very easy to cut through muscle tissue with a scalpel and we want to keep our muscles intact. You will use scissors. This is called a blunt tip probe, and so you'll notice most of our blunt tip probes actually just have one end and then the rest of it's a handle. This one also has a kind of a paddle on the end of it, which is really nice for separating things. And then lastly, a pair of tissue forceps. And the nice ones are the ones that have the little teeth on them because they can pull at connective tissue. So those are going to be your key elements that you'll utilize to dissect your cat. When you first get your cat, you're going to want to cut open the bag and drain the fluids into the sink, and then go ahead and rinse those down the sink. So I am going to do that and then come back to you. This cat actually has been sitting for about 10 years, and so I'm a little worried about its condition once I open it. So I'm going to go ahead and open it and we'll be right back. What we have is a male, more on the small side cat. Most of you will have a what we would consider a large cat. Sometimes they don't even fit on the pans diagonally, but I like larger because they're less kitten-like. What you're going to do once you get your cat out of the bag is you want to basically give it a good massage. We're going to say, hey, thanks, we're going to give you a massage here. But the goal here is we're going to start with our cat on the belly, and we want to lift up the skin so that we can start the skinning on the back. So we do have some muscles that we're going to identify on the back and shoulders, so we want to be careful not to cut deep down in. So again, we want to lift the skin up a bit. We are going to use the scalpel. If your cat has a lot of fur, it's either a good idea to separate that out so you can see the skin, or you can even give them a little tiny mohawk region so that the skin is visible where you've lifted it up. So I'm going to carefully insert the scalpel, not too deep, just a real superficial cut, with the goal being I'm just going to make a tiny opening with my scalpel, and then I'm going to put it down and pretty much never use it again. So once I've got that opening, I can do a couple of things. If it's big enough, I could put my fingers in there. If you're not quite ready for that, the blunt tip probe, either end works fine, as long as you're not digging too deep. So the goal here is just lifting the skin up off of the muscle. So our skin's attached to our muscle with this loose connective tissue. And so we want to just lift it so that we can cut again. So once we've lifted it up about an inch, inch and a half or so, now we're going to take our scissors. And you'll notice on the scissors there's an end that has a blunt tip. So we want to insert the blunt tip end in there so that I know I'm not cutting through any muscle. And just going to cut until I reach the point where I stopped lifting it up. And then I'm going to lift again. So I set my scissors back down. I now see this nice loose connective tissue, so it looks kind of spider webby. And I'm just going to keep separating that skin from the muscle. Been accused of being real rough about this, but you'll have to remember I've been doing it for a lot of years, so I know what's what. But you'll get it figured out after a while, the difference between what muscle looks like, what connective tissue looks like. And I started kind of low on this cat, so I am going to back up a little bit and go a little more towards the neck, because I do eventually want to have the skin just left kind of like a cape around the back of the cat, and I want to leave it on the head and face. So I'm not going to do anything with the head and face. If you'd like to cover it with a paper towel for this entire dissection, you are more than welcome. But notice this little paddle structure on the end of this blunt tip probe, or even the end of the blunt tip probe can work this way too, to just push down on the muscle, separate it from the skin. And do the same thing on the other side, so that lovely loose connective tissue just holding the skin on. If you've ever hunted before and killed an animal, it's really easy to actually skin an animal that's freshly killed, because they still have a lot of fat and things that keep everything loose. So we're gonna work from the neck back down to the base of the tail, just continuing to lift and loosen. Once you start feeling more comfortable, you can get your fingers in there. We are going to have some superficial muscle on the skin, so think about, how a cat will like puff up its back and try to look bigger. They do have some superficial muscle in the skin that allows them to do that, so some of that will stay attached to the skin, but we're not going to worry about that as long as we haven't created these big holes that we might see. The other thing you're going to see as you go along are nerves that are going from the body of the cat into the skin area. So this is actually not a nerve, this is a blood vessel because it's got some pink in it. These cats are dissected with pink and blue, injected with pink and blue. And so the arteries come out pink and the veins come out blue, so they're easier to identify. So you start to see some obvious muscles appearing as you get going along. Some cats are different colorations, so not all cats are going to look exactly the same when we get inside. So there's something about their chemical makeup and how it reacts to the chemicals that they use to preserve them. Determines if you get pink muscles or yellow muscles, or so. And then the real fatty cats sometimes look different too. So again, just going along, separating down as much as I can. I don't want to go to the front too much because I've got some muscles there I want to be careful of, but once I get to the base of the tail, that's going to be a little bit more challenging. So my goal now is, I don't need to skin the tail, so I'm going to stop at the tail, but I want to head down a leg. But I want to be careful when I'm heading down a leg to do the same thing I was doing here on the back. And so I want to loosen, and it's the skin is thinner on the legs, and so it'll tend to stick to the leg muscles a little more. But I want to make sure I loosen it first. So don't cut until you have it loosened on both sides, because if you cut and it's still attached, it's really hard to disconnect it from the muscle at that point. One thing you'll notice as you're going along, or maybe even when you first open it, is our cats will have a cut in their neck and a cut in one or both of their legs. And that's for the injections for the pink and blue in the arteries and veins. And so they inject it in one area, the blood comes out the other area. The other thing you'll notice is our cats are declawed. So basically their claws are just cut off. Here's an example of a claw that was in here. So that's just to keep the cat's claws from puncturing the bag, so that they, but also, kind of protects you too. So while you're dissecting, you don't get scratched. All right, so once I've got this loosened up well enough, I'm gonna go ahead and do a cut. But again, like I said, I'm gonna cut right down the center of where I loosened. So I don't wanna stop right on the edge. And I'm gonna keep loosening, and I'm gonna move the cat back and forth a little bit now so that I can get to both sides. So still loosening. Again, still being very careful. We are spending a lot of time on muscles, and if the first day you tear through all the muscles or cut through all the muscles because you were scalpeling when I told you not to scalpel, then you're going to be sad when you're trying to identify, because they're really hard to identify once you've cut through them. So we want to separate our muscles out so that we see exactly their shape and size and so forth. One thing you can do once you get far down enough is do a little bit of peeling. I know it seems gross, but some cats, their skin is loose enough that you can peel it off. Some cats have very thick skin, so this isn't even possible, and you'll just have to do the lift and loosen technique all the way down. So you'll find out once you get into your cat right at first. It's tends to be, I think the male cats have a little thicker skin. Okay. So once I get to the bottom of the foot, so I see the heel right here, the calcaneus, I am gonna just separate the skin at this point. We're not gonna identify any of the muscles or tendons or ligaments in the foot. So I'm just gonna go ahead and snip around, leave a little boot. So that's completely dissected there. Now I did leave a little chunk of skin extra here, and I'm gonna go ahead and remove that when I get around to the other side. So it's, I mean, it's nice to have a modesty patch, but that's like pants, and I don't think we need quite that much. So you're gonna do the same thing on the other side. Sorry, need a different thing. Loosen, cut, and if your cat's skin is thin enough, you can do a little peeling. Thumb makes a really good loosener, or if that grosses you out, use your blunt tip probe. Again, not scalpeling here, but I can use this paddle towards the skin, sort of like a scalpel where it's cutting through that connective tissue. Now, some of your cats that have a little more fat to them, what you'll see, start to see some fat pads here. This is a real thin cat, so I'm not gonna have to run into that on this guy. We do want to try to keep the skin in one piece. So what we will utilize the skin for later is to keep the muscles moist. So if they start drying out, it's harder to identify the musculature later on. So we're gonna lift the skin off and then put it back on each night when we're done. So I now have the cat flipped over onto its back. I've gone through several gyrations here with this poor little guy. And I'm gonna go ahead and separate the front section now. If I have a male, which I do want to watch out for the spermatic cords. So remember, the testes in mammals start up in the pelvic cavity, they leave the pelvic cavity and travel down and enter the scrotum. So there's going to be a couple cords right here just under the skin that I don't want to snip through. But I do want to go ahead and get rid of some of this excess skin. So I'm going to just peel a little bit so I can get to just right in that center. You may run into blood vessels here. If you can, attempt to pull them off and lay them back down. So just kind of fun to look at. We aren't going to identify a lot of the blood vessels down in the lower portions because a lot of our cats don't have it injected all the way. So I'm going to go ahead and take off a little bit of the pants material here so that I'm just leaving a modesty patch instead. Again, I want to be careful not to snip those spermatic.